For urine collection, first you need to introduce yourself to your patients. You need to make sure that they know who you are, what you're doing, why you're doing it. So it would go something like this. Hello, my name is Lena Bishili. I'm your medical assistant for today. I'll be doing urine collection, which your doctor ordered. So you introduce yourself, do all of that. For urine collection, there's 3 different things. There's different types of urine collections that you can do. First one being the regular one. It's where the patient just pees in the cup. They make sure to remind them to close the lid tightly so that the urine that's inside the cup doesn't spill over the person being handed the cup. And also you could tell the patient to put it in a paper napkin so that there's less of a chance for the person being handed the urine in the cup to make contact with the urine. Another method that you could do would be the wiping method. This method is important to make sure that everything is not sanitized, but that there's not as much bacteria. So each patient, depending on whether they're male or female, they're going to have to do different wiping methods with 3 wipes that they're going to be handed. For females, they would do left, middle, and right. So they would wipe the left side of their vagina and the middle part of the vagina and the right side with 3 wipes, 1 for each. And they would do this top to bottom, from the clitoral hood to the anus, in just 1 wiping motion. They would not do side to side, just top to bottom. For males, they would wipe the base of the penis, and then with the second wipe, they would wipe over and around the shaft. The shaft is for the second wipe. And then with the third wipe, they would use the bottom over the head. And then for both, they would pee in the cup afterwards, after they're done cleaning. And it's really important that they keep in mind that their hands, their body shouldn't make contact with their genitals or with the cup, because this can contaminate the urine and it can cause inaccurate test results. For the third method of urine collection, the patient has to keep in mind that the bottle that they're going to be handed to urinate in, it has boric acid, which can be abrasive to sensitive parts of the body, like genitals. It has not sensitive parts, sensitive skin parts of the body. The sensitive skin of the body. It can be abrasive to it. So they have to be reminded that their genitals cannot make contact with the bottle because it can be abrasive. So that's something that you have to make sure that the patient knows. And another thing is, for females doing this type of urine collection, female patients, they have to pee in a cup because it would be more comfortable for them. Since females usually urinate in the toilet sitting down, they would have to pee in a cup. And if the female patient knows that they pee a lot, then they should use a bigger cup, because for this type of urine collection, it's very important that the amount of urine collected is accurate, most accurate. So the patient, it's important that they know that they have to, pee into the bottle. It's important that the right amount is in there. Another thing is, for the males, their genitals cannot make contact with the bottle. So if they're urinating into it, they need to make sure that their genitals do not make contact with the inside or the outside of the bottle. For this type of urine collection, it's the 24-hour method. Not 24-hour method, 24-hour urine collection. This type of urine collection, they would have to do it, the patient has to do it on a day that they're completely free. The bottle also has to be kept refrigerated whenever it's not being used. So for this urine collection, what they do is, on the day that they're free, on the day that they're doing this type of urine collection, the patient would, the first urination of the day in the morning, whenever they wake up, they would not urinate into the bottle. They would urinate normally into the toilet. Then for the remaining 24 hours after that first urination, they would urinate into the bottle. This is for both males and females. That does not change. So the patient has to keep this in mind, that the first urination of the day goes into the toilet, not into the bottle. And then when they're done for those 24 hours, the next morning, they would urinate into the bottle. for that morning, and then they would just stop. That's the full urine collection for the 24-hour urine collection, and that's it.